Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I'll be your host. Today's guest is Dr. Knut Wittkowski. Dr. Wittkowski, it is such an honor to have you on the show. Can you please tell me a little bit about your background? We're going to be talking about the pandemic that we're seeing currently, and tell me a little bit about why you are the perfect person to talk about that.
I'm not sure if I'm the perfect person, but I think I have something to add to the discussion. I've been an epidemiologist for 35 years. I trained and worked with Klaus Dietz in Tübingen in Germany as one of the leading epidemiologists who actually coined the term reproduction number. I was one of the few who early on said that HIV would not spread into the heterosexual population, and actually it was true. But it came out only after a couple of years, and now I feel that I should raise my voice again because I think that many of the interventions that are currently being tried and implemented are not well thought through.
So tell me a little bit about, obviously this virus, the coronavirus, has everyone running scared, thinking that all their elderly are going to die of any exposure, and now it's impacting younger population, and thinking that we have to isolate ourselves in order to be able to protect ourselves, and then and just kind of sit huddled down until we get the vaccine, and then we will be safe finally. What are your thoughts in regards to how this has been taken care of so far?
Okay, as in every respiratory disease epidemic or flu, those who are elderly and fragile, at high have comorbidities, should stay away and not try to expose them too much to the circulating virus. Other than that, it's probably the best to rely on what nature has come up with over the last 100,000 years or so, and that is a way for humans and viruses to coexist. So every virus that enters the human population stays there for a week or two, and the number of people who are infected rises and then reaches a peak, and in the next one way or two, the number of infections declines. In the end, the virus is eradicated because there are more people in the population that are immune, many more that are immune than those that are susceptible. So anybody who brings a virus into that population would not create any further infections. And then the whole story is over. And it's a natural course of every disease, and we don't really need to do much about it.
So now it sounds like you're talking about the term herd immunity. Can you explain a little bit about what that is? Because that seems to be the solution in your eyes.
Yeah, it's a term that is often used and often not well understood. So as a disease spreads and people become infected, after a week or so, they become immune. The vast majority of them. And as soon as there are more immune people than infected people in the population, the spread of the disease stops. And about a week later, it reaches a peak and then declines again, because then the majority of people are already immune and only a minority is susceptible.
So the issue with this virus, it seemed like it was spreading. I mean, the estimations were that it was going to hit the population in such a massive wave that we had to take a massive precaution. what do you feel about those estimates that they were having? Were they based on good calculations? What were they based on?
Guesswork. So I haven't heard any epidemiologist being asked. And everything that was discussed was based on the opinion of people who didn't really understand how epidemics spread.
Because the scary part is that, I mean, a virus, you're looking at something you can't see, and it's everywhere, and you have no idea if you're exposed to it. And also with this virus, then people can be asymptomatic and they can still be carrier, and then you can be exposed to it, and then so there's a lot of fear in because you don't know and you can't see.
What you are describing is what we go through every year during the flu season. The flu season is called flu season because there tend to be flus. And so every year we have a flu. And every year that flu enters the population, starts spreading, and then the spread declines, and eventually it's gone. We can never see a flu. We never know whether we are infected or not. And until this year, as the president said, we have never shut down the economy for a flu.
So why are we taking such strong measures now versus if this is just the same as a flu season, why are we taking such strong measures?
I have no clue. Maybe it is because the internet is now a medium where rumors are spreading faster than any virus could spread. And then people get infected by these rumors. And that's causing their fear. It is also that, at least here in the U.S., I could observe that. We had both the president and in New York City, the mayor, saying on one day, we are not doing anything because this is just a flu. And on the next day, saying, no, we are shutting down the country or the city. And I don't understand what is causing politicians from one day to the next to change from saying something reasonable to something that is unreasonable.
So I would assume that you as an epidemiologist would have access to the data that's available and also have you would be the expert to read that data to see whether this is something that we need to react stronger versus having just the same kind of precautions we would if there's a flu season.
The data, or a lot of data, is actually available. The New York Times makes data available. The European CDC is making data available. There's several sources for data available. And if you analyze it, then you see that there's no major difference between this epidemic and other epidemics. The only difference that we see is that everywhere where social distancing, although I don't know how social that is, was implemented, it takes more time for the virus to reach the level of, as you said, herd immunity, and therefore it stays longer in the population, and the longer it stays in the population, the more the elderly and highly susceptible people are at risk.
So
So we're, by what people call flattening the curve, they're increasing the risk for the elderly and the number of deaths. It is better to let nature take the course because nature has played with this for a very long time. And we as humans are not always better than nature in predicting what is good to do.
So you're actually thinking that the social distancing was detrimental and that would then prolong this epidemic that we're dealing with and then possibly prevent us then from getting herd immunity. Is that what you're saying?
That's what's happening. Now, the argument is that people say they are afraid of the health system being overwhelmed. But if you don't shut schools, then children will get infected, most of them, and the vast majority of them will have no symptoms or minor symptoms at most. And so once the children are all immunized, so we already have a high level of herd immunity, and that will protect the elderly. If we prevent the children from becoming infected and becoming immune, then the virus is spreading among other parts of the population, and that is the elderly who are at risk. So by producing a new form of prohibition, what we are doing is we're actually increasing the risk for the elderly to become infected, become seriously ill, and then die.
That's fascinating. We're going to take a quick break. I'm Dr. Michael Karlfeldt. You're listening to HealthMade Radio. I'm here with Dr. Knut Wittkowski. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with epidemiologist Dr. Knut Wittkowski. So before the break, you were mentioning that the appropriate thing to do is to keep children in school so that the virus can pass around the part of the population that has, that evolutionary-wise, have a strong immune system, and they can handle this, and they will then be able to pass this virus around without really getting sick, and not really, the majority of them not having symptoms. And during that time, then it will then promote herd immunity, and that herd immunity will then protect the elderly later on. Am I hearing you right?
Yes, during that time, the elderly should try not to get in contact with children. They should stay at home and reduce their exposure to the circulating virus as much as they can. That is something that makes a lot of sense, and that is something that people have been doing all the time. If you know there's a virus spreading around, then you don't take the subway or a bus or other things. You stay at home and wait until the virus has spread and there's herd immunity, and then you can go back and the grandparents can play with their grandchildren, and everybody is happy because the virus is gone. It has taken its course as nature has prescribed it, and it's over. And it doesn't need any further intervention.
And so if you do it that way, then what would the need of vaccination be?
Well, the vaccination speeds up the process, because then you have already part of what otherwise would be needed to reach herd immunity. It's already there.
And what I'm curious about, though, because this viruses, they're known to mutate. You know, they're known to, you know, how they affect one population. What they look like in Asia may be different than what they look like in Germany, for instance, and probably here in the United States. So if you develop a vaccine, how are you able to be then specific to the strain that you're dealing with at the time?
Viruses don't mutate that fast. So a virus that enters the population stays more or less the same for the next couple of weeks or even months. So the immunity protects. Is that the question you had? Sorry if I didn't quite get what your question was.
Yeah, that's okay. I was thinking in regards to the vaccine, because you need to obviously be fairly strain specific, I would assume, to trigger an immune response for the vaccine. So if we're in the making of a vaccine, let's say they roll it out like 6 months from now or so, how are they going to be specific in regards to the virus we're dealing with right now to be able to make sure that vaccine is working?
The virus wouldn't mutate that fast. So there's always a cross-immunity. So even if the virus changes a bit, a vaccine would still be effective. But the problem is sometimes vaccines are actually increasing the immune response in a way that is not foreseen. And we have had cases where vaccination actually made the disease worse. So it's very important that we first test the safety and the efficacy of a vaccine before we give it to the population, and that is going to cost time. So I would not expect any vaccine to be available within 12 months. I think it will take more time.
Okay, so yeah, because it would need to go through the proper safety channel to make sure that what you're rolling out.
Definitely.
Has a vaccine been tested in the past for the coronavirus?
To my knowledge, they tested the coronavirus in animals, and that was one of the cases where they tested the vaccine, and that was one of the cases where the vaccines made it actually worse.
Okay, so it actually was detrimental. The only test we've done so far, it was detrimental at that time.
Yes, I mean, it remains we should keep in mind, we are not really suffering from the virus being there. Most of the viruses don't cause any major symptoms by themselves. We are suffering from the reaction of the immune system killing all the cells that are infected, and that creates a lot of inflammation and all the problems that come with it. Now, if the vaccine makes that immune response even more rigid, stronger, then it could be that the effects or the symptoms of the disease get worse. And that is one of the fears that we have and why we have to be careful in the development of vaccines.
So it's not, if I'm hearing you right, it's not really the virus that kills you, it's more the impact of the immune system, the inflammatory response or the immune cytokine storm that they sometimes refer to, that really can impact you and have a negative effect. It's not the virus in itself.
Yes, and that can cause respiratory problems, that can cause bacteria to settle down on the inflamed skin and then cause pneumonia. So there are all these consequences of what the immune system does. It's rarely the virus itself. If the cells have to produce some more viruses, they could shrug that off.
So it's not really, we really don't need to be afraid of the virus in itself. We just need to make sure that the immune system behaves properly around the virus.
And that is what vaccines are for. So the immune system is trained. The immune system knows already how the virus looks like, and so the immune system can react immediately if if a virus enters the body, and so the number of cells that need to be killed is only minor, and there is no major immune problem.
But then, as you mentioned, the key then with the vaccine is to make sure that you have it at an appropriate dose or strength, so you don't overwhelm the immune system to have a hyper reaction.
Well, I don't think, but I'm not a virologist.
Yes.
I don't think it was well known. It is well known why the SARS vaccine created these unexpected overreaction of the immune system. But things like this can happen, and this is why we need to test thoroughly before we can make something available to the public.
Yeah, wonderful. And going to the SARS, because SARS, the virus we're dealing with now is very similar to the SARS virus. I mean, it's called COVID SARS and impacting the respiratory. When we had that outbreak of SARS and then it disappeared, so is that what you're thinking will happen again with the coronavirus?
Okay, we had a SARS virus in 2003, if I'm correct.
Yeah.
And we had the MERS virus in 2009. And now we have another SARS virus. They're all coronaviruses. They all come and go. This is not dramatic. This is the normal thing that's happening during the flu season.
And so, because there is so much, I mean, we're looking at the flu season, but we never see that this kind of heighten, so many people dying, and so, I mean, is it just because of the media, or is it that it was different in some way?
It's not, so the only difference is that this flu may cause a bit more severe respiratory symptoms than other flus. So flus are coming slightly different, but there is no fundamental difference. And the politicians, as I said, both the president and the New York mayor, originally had the correct approach. They would say, this is a flu. We did never shut down the economy for a flu. We don't shut down schools. It doesn't make any sense. We just wait it out. And for some reason that is unknown, that changed. The economy was shut down. It was costing $2 trillion. And one can only imagine how much good one could do with $2 trillion. And it's not clear yet that it won't take more money than $2 trillion. So I think this was an overreaction in many ways, and it was due to not having epidemiologists involved in the whole decision process. That's my view.
We're going to take a quick break. You're listening to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Knut Wittkowski, epidemiologist with a background at the Rockefeller Institute. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with epidemiologist Dr. Knut Wittkowski. He has been an epidemiologist for 35 years, so I would say that would give him credibility in what you have to say. I'm curious, because one of the things is that in order to be able to react appropriately, you need to have appropriate data to be able to have an appropriate action. And do you feel that that appropriate data was available with the action that we took?
The data that was available did not ask for the action that was taken.
And do you feel also that and in order to be able to get data, you need to collect it in a very scientific fashion and in a consistent fashion. Do you feel that has taken place?
Not to the extent that I would have wished. We had in different countries at different times, starting with China, situations where either the definition of the disease or the process of collecting data was changed in the midst of an epidemic. And that is the worst thing that could happen if you try to make sense of data. If you try to see what's changing over time in the epidemic, you don't want to change the way the data is collected during the epidemic. And unfortunately, that happened.
So it means that you actually, by changing the way that you collect and report data, you can actually then skew how the numbers look to make it look worse or better, depending on what direction you're...
Well, what you see is you suddenly have spikes in the data. And you know that nature does not jump, as Darwin said a long time ago. So you know if there is a spike, the spike must be an artifact, but you don't really know where the data comes from, and then you have to wait for a couple of days until you can understand what actually happens. And these couple of days can be important and delay whatever decision you would want to make. But there was actually enough knowledge available to tell you to which point you should wait, and then what is the right window of opportunity to do an intervention, if anything. And that opportunity was not used.
Okay.
Or taken advantage of.
The opportunity to wait and
to wait and to decide exactly what is the right point to do an intervention. So once the number of people who are infected has reached the highest point, you could actually start a short-term intervention and drive the epidemic down faster than it would normally go down. That can make sense. But if you start too early, you just protract the epidemic, make it lasting longer and longer and longer. And then if you stop, you may even have a situation where the epidemic starts again simply because you haven't allowed the epidemic to create herd immunity.
So if we, because obviously there's different, or somewhat different interventions and different timing in what happened in China, then in Europe, and here in the United States. Could you kind of take us through the progress of the pandemic and how it impacted the different countries differently?
China had and South Korea had the advantage that very little was known about the virus. And so they did not, like many other countries, start too early because they didn't have the data yet, the information yet that one might want to start. So they started only very late, and therefore the intervention had little of an impact, but at least it didn't do any damage. Otherwise, we have a very good example, and that is Sweden. In Sweden, there was no social, as I would call it anti-social distancing required or employed. And now we can compare the epidemic in Sweden to the epidemic in the neighboring countries, Norway, Denmark, and Finland, all around Sweden. And we see that the course of the epidemic in Sweden was exactly the same as in the three neighboring countries. So the effect of what they call social distancing, the effect of prohibition was nil.
Because in Sweden, all they did was suggest on the elderly to, especially the immunocompromised with respiratory or heart conditions, to be cautious and to quarantine themselves, and then business went on as usual, just with a little bit of awareness of the social distancing, correct?
The awareness of the social distance, I don't think is very effective, as we have seen in Sweden and the neighboring countries. And the thing that is effective is to isolate for those who are highly susceptible, to make sure that they have as little contact with those who are infected or potentially infected as possible. So to isolate themselves, whatever you call it. That makes sense, and we would do that in each and every flu epidemic that is around. I mentioned that earlier. During a flu epidemic, if you are scared of becoming infected, you don't use the subway, you don't use buses, you don't go to places where a lot of people are around, because that's where you can easily get infected. So you stay away. But there is no reason whatsoever to stop businesses from doing business, and in particular to stop children from going to school.
So then going back, you said that South Korea and China had an advantage, meaning that they didn't implement social distancing until later on because they were kind of caught unaware. They started
implementation at the point where the number of cases had already reached the maximum or the peak. And that means that the number of infections had the peak a week before and was already declining, had already declined. So when they started the intervention, it didn't do much. And that was actually good. And that's why the epidemic in China and in South Korea was over after about 4 weeks only. While right now in Europe and in the US, it's taking a lot more time.
And because we had the disadvantage of knowing ahead, and with that we initiated the social distancing before, kind of in the course of action of this epidemic.
The advantage of having knowledge was not combined with the methodology to make use of it.
Okay. We did not do the appropriate action with the knowledge that we had.
Correct.
Okay. And the appropriate action would have been that we would have looked at China and South Korea and seeing that it peaked on its own and then it was dropping even before social distancing. So there is no reason to do social distancing here.
Yeah, the problem with epidemics is these are systems that are non-linear. So a simple linear thinking. We do more of this, and then it has more of an effect of that, is not necessarily true. It really depends what you do at what time in the epidemic, and this basic knowledge of epidemiology was not considered and taken advantage of.
Right. Well, we're going to take a quick break. I'm Dr. Michael Karlfeldt. I'm here with epidemiologist Dr. Knut Wittkowski. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with epidemiologist Dr. Knut Wittkowski, and we're discussing the current pandemic that we are dealing with. I'm curious, what are your thoughts why it went so bad in Italy?
Well, Italy has, next to Japan, the oldest population in the world. So there were many people who were old and had lots of comorbidities. The average age of those who died was 81 years. And the Italian government has created a very detailed report saying that of those who were young and had no comorbidities, virtually nobody died. All deaths were among the elderly, 75 years and older, and those who had many comorbidities. And so you had that very fragile population there, and it might even be that a slightly different virus strain came to Italy that was a bit more dangerous than other virus strains, although that is a hypothesis. The data could suggest that, but I wouldn't yet state this as knowledge. And
I heard also that the kind of urgent care system is not really as fully developed there, or they have kind of strong limitations. So if there's a flood of people that are needing help, they may not really be able to accommodate that.
I can't really comment on that. I don't have not enough information to speculate about what that contribution might have been.
No, that's okay. So with that then, and then going back to Wuhan, I mean, if we would have seen a normal flu virus going through Wuhan, would that have behaved differently than this virus that we're seeing?
No.
It wouldn't. So it would have been, we
No.
would have seen the same, it's just that this was hyped up.
Yeah, it was just that for whatever reason, this was treated as something dangerous, and people were looking at it and investigating things that typically would not have been investigated.
And how come, do viruses spread this fast normally? Because it seemed like we had the first case back in beginning of December, then all of a sudden we had it in 100 countries. I mean, is that usually how things go?
So epidemics start exponentially. That is, initially, the growth is very, very, very little. And then the curve increases, and suddenly it becomes very steep. But then it slows down again. And so it is very typical that during the first month or two, you don't really see anything, and then you start seeing something.
And so with that, then you, but then again, because it's we were starting to see it in February here, I would assume, and so that would have been you get December, January, then February, so like 2.5 months. Is that the appropriate time then for it to spread to so many countries?
Sorry, what was it? To do what?
Is that the appropriate amount of time for a virus to spread to so many countries so fast?
Well, it moved from China. It took a month or even more to go from China to South Korea, and then some time to go to Iran, and then to Italy, and then to other European countries. And this is not, so there were several parallel paths. So the more countries have been affected, the more origins for a separate path exist, and the faster it goes to the next. So what we see is something that is very typical for a virus.
So the rate of how it is moving forward and also the impact on population is, I've heard you say this many times before, but I just want to reiterate, it is not very much different than any kind of flu season.
No, not at all. And I want to go back to the numbers in the United States. So every year during a flu season, we have around 35,000 deaths in the United States. So far, we have 10,000 deaths from this flu. That even if this should double, if it should become 20,000 deaths, it would still be at the lower end of what is a typical flu season.
So I'm curious, because are they creating some kind of separation between normal flu deaths and coronavirus deaths, or are they all becoming coronavirus deaths now? Do we have statistics on both that they're running right now?
It is rare that you have two viruses entering a population at the same time. So I wouldn't expect another virus to be circulating here right now. Could we exclude? Would it be possible? It would be possible. We don't know.
So the deaths that are currently taking place due to this flu season, are they all considered to be coronavirus related, or are they related?
We don't know.
We don't know.
We don't know because right now everybody who dies with the virus or with symptoms that are also seen with the virus, the coronavirus, is considered a corona caused by the virus. And that is simply not true. So that is exaggerating the effects of that virus. It may well be that in Italy, for instance, some of the 90-year-olds who died for other reasons. They just happened to also have had been exposed to the virus, but the virus didn't do anything, or the immune system didn't do anything. So they died of something entirely different, and they're still considered cases of SARS or COVID.
And then you have the question also that if an individual, it may be that individual wouldn't have lived that much longer anyway, that they were kind of on that cusp, and then a flu.
I mean, people in their 90s, they tend to die at some point in time.
That is correct.
That is sad to know, but on the other hand, this is just how life is. That is natural.
So and I apologize for harping on this. So the number of flus or number of flu deaths right now, if you lump them all together, coronavirus and all the other things that would be considered influenza right now, it is not much different in any shape or form than it has been the other years.
No, not at all.
So what is it? I mean, because they're calling this virus a novel coronavirus. What does that even mean?
Yeah, it means that this particular coronavirus has never been seen before.
It doesn't mean that it's more dangerous, or doesn't mean it kills more people. It just means that you haven't seen it before.
Yeah.
And
even every flu that is. So every influenza virus that's coming around is also one that's novel, because it at least has not been around for something like 15 years. because otherwise people would already have herd immunity and the virus couldn't spread.
So the best thing right now, just to kind of summarize it, is for children to go back to school, pass the virus around.
Definitely. Skilled children should go back to school. This is the worst thing you can do, not only for the epidemic of the virus, but also for the children.
And that will then strengthen their immune system. They will develop immunity. They don't need vaccines if they're already immune, I would assume. And that would also then transfer immunity to their parents. And we will then start to build herd immunity that will then protect the elderly, from this virus.
Correct.
Okay. And so with this, with what we're doing right now here in the United States, where do you feel we are at right now, and where do you feel we're heading with the actions we're taking?
I think the action of closing schools is definitely the worst that could have been done. The whole antisocial distancing or prohibition or whatever you call it is totally unnecessary and has cost at least $2 trillion and 7 million people becoming unemployed. I think in many other social problems, I think the cost of all that is immense and it was totally unnecessary. I don't know why politicians resorted to doing something so drastic to deal with something with the virus, flu during the flu season.
And I would assume that the impact of this depression, that economic depression that it looks like, or recession that we're heading into, that would have a impact on our health system as well, with other diseases that are going to be more prominent that will outweigh.
Of course it has, because $2 trillion were spent on damage control. Just imagine what you could have done with $2 trillion spent intelligently on a tunnel between New York and New Jersey, or other infrastructure projects, or on health, improving hospitals, providing hospitals with more of the stuff that they need and is now lacking. If these $2 trillion had been spent intelligently, the country would be in a much better position than it is right now, where $2 trillion have been spent, increasing the deficit without any benefit.
And another point, or another question I have, then we need to close. The mass testing, how important is that to prevent outbreak and also to help us in the future?
Testing in this situation doesn't help a lot. As an epidemiologist, I would like to see eventually antibody tests to see how much herd immunity do we have. But that's an easy thing to do, and you don't even have to do that right now.
Great. Well, thank you so much, Dr. Wittkowski. It's really, I appreciate what you're doing, and that you are a sane voice in all this in all this craziness right now. So I really appreciate that. Do you have any closing remarks that you'd like to say?
No, what I like to say is that on a broader scale here is one of these examples where politics not listening to science is creating problems. It would be better if politicians would put the infighting aside and say, well, you are a scientist appointed by this, and you are a scientist appointed by there, and politicians should interact with scientists, learn from them, and I think that would make the world a better world.
I agree. Instead of doing these knee-jerk reactions that have tremendous consequences, it'd be nicer to
Maybe
have...
one last point. I think we should also listen to nature. Nature has thought about all of this, and when we are screwing up what nature has designed, it's not always beneficial.
Thank you very much. That is it for today. You're listening to HealthMade Radio. Remember, check us out at healthmade.co. Health is what you make it.